Hi, I'm Daniel. I'm a sleep physician, and if you have insomnia, this channel is for you. Today I wanted to talk about cognitive behavioral therapy for insomnia. Not a specific technique, but rather the concept itself, what it involves, and why it is so important. Cognitive behavioral therapy can be used for things other than insomnia. It can be used, for example, for phobias or for stress, anxiety, but the principle is the same. The cognitive part involves correcting false beliefs and general education, and the behavioral therapy part involves specific behavioral modifications or changes in approach to various things. When it comes to insomnia, we've already gone over some cognitive therapy, which involves, again, debunking myths and correcting false beliefs about insomnia. When it comes to behavioral techniques, there are 5 to 7 depending on who you ask, but I've listed here what I believe are the 5 techniques universally considered to be part of CBTi. First on the list, bedtime restriction. I believe this is the most important technique there is when it comes to treating insomnia. If you haven't watched it, do watch my video Insomnia Insights #1 Bedtime Restriction. If you want to learn more about it, let me know. I would love to tell you more about bedtime restriction. Oftentimes in clinic, if I have patients that come in for something else like obstructive sleep apnea, it turns out that they also have some insomnia and we don't have that much time, I often only go over bedtime restriction, and you know what? It often is really helpful by itself. Number 2, stimulus control. I use that a lot as well. Stimulus control involves only using the bed for sleep. For example, if you wake up at 2, 3 a.m. and you're finding it hard to go back to sleep again, then leave the bedroom and only go back to bed when you're feeling as if you could fall asleep again. Number 3, paradoxical intention. This is a cool technique. It's a little different. Now, insomnia can be a little bit like performance anxiety, like the one that athletes often have, meaning the harder they try to achieve something, the less they actually achieve. And insomnia is often the same, meaning the harder you try to sleep, the less sleep you actually get. So paradoxical intention involves going to bed, actively trying to stay awake. So you go to bed trying to stay awake. Paradoxically, it can help you sleep. I don't use it very often. I should maybe use it more often because there is evidence to support it. Now, number 4 and 5 here, I'm not as familiar with. They're typically more in the psychological realm, done by a psychologist, but again, there's a lot of evidence supporting them. Relaxation techniques, there are several. One of them includes progressive muscle relaxation, where you, for example, start from your toes and work yourself up, and you tense up your muscles and then relax them, and then you move up and tense muscles, relax them, and so forth. And then we have biofeedback techniques. These techniques work by making you aware of some physiological parameters, like, for example, your heart rate or your respiratory rate, and somehow making you modulate, change these to allow you to sleep better. Now, why is CBTi so important? Well, there is tons of data showing that CBTi is very effective for insomnia, and that it is more effective than anything else out there, including medications. A big problem with medications for insomnia is that you develop tolerance. That is, after a while, the medication that initially may have worked is no longer working. You have become immune to it. You've become tolerant to it. Now, you cannot become tolerant to CBTi. In fact, the more you learn about CBTi, the better it works. Hope this was helpful. If it was not, please let me know. And until I see you next time, stay out of trouble.